Starting off today with Chapter 1 Introduction to Health Assessment. Health assessment is a systematic method of collecting and analyzing data. Just like when we talk about doing our head to toe assessment, we do it in that systematic order, that step by step, because there's so many different things that we have to assess. You really want to get into a flow, we want to make sure we haven't missed anything. And these are going to be used to create those patient centered plan of care. When completing our health assessment, it's going to be comprised of three different components. And it's going to start right there with the patient's history, beginning with their chief complaint. What is their reason for being here? What is their current issues? And we're also going to want to run through their previous health history. What problems have they had in the past? And a lot of this history is going to be comprised of subjective data. And this is going to thing we need to talk about right at the beginning, the difference between objective data versus subjective data. Subjective data is going to be those things that the patient reports that we're not able to physically assess ourselves, versus the objective data. These are going to be those signs and symptoms that we can physically see, physically assess. An example would be a headache. We can't physically see that patient's headache, but we have to take their word for it. There is no way for us to physically assess that headache without the subject, reporting it. And that is subjective data. On the other hand, we can collect objective data, such as a blood pressure. We see that blood pressure is high. We now have objective data showing us why they have that blood pressure. From there, we're moving on to, again, that physical examination, that head to toe assessment. And then finally, wrapping it all up at the end is going to be our documentation of that data. We want to be thorough. We want to be objective. We want to be accurate. We want to state the facts in a way that anyone else reading this would also be able to clearly understand what's going on with this patient. For data collection, a symptom is going to be what the patient feels and communicates. Symptoms are subjective data, not to be confused with signs. These terms signs and symptoms get used interchangeably a lot, but they are different. Symptoms are the subjective portion versus a sign being that objective portion. These are those findings that we're able to physically assess for ourselves. And again, wrapping up with documentation of data. This is where we improve that plan of care. This is a legal document of the patient's health status and provides the baseline for everything from evaluations, allows us to identify any changes in the patient's condition, and helps to determine any decisions that are going to be made for the patient's plan of care further down the road. We have to be accurate, concise. We want to keep any opinions out of it. And it must be done at the time of care. Nobody wants to be that nurse that's documenting at the end of shift. 10, 12 hours later, how accurately are you still documenting and remembering this patient's situation? We want to complete our documentation as early as possible after we complete that assessment. The amount of information gained during a health assessment is going to depend on many different factors, such as the context of care. Where are we completing this assessment? Are we right out up front in triage? Or are we back in a private patient room? And that environment, that patient situation is going to depend a lot on how thoroughly we're able to assess this patient. Is this patient verbal or is this patient nonverbal? Is going to be going a long way to determining how thorough our assessment is going to be. It's also going to depend on the patient's needs. How serious is this patient's injury? What is their chief complaint? The context of care refers to circumstance, situation related to that delivery. It could be the setting, the environment, or it could be, again, related to that patient's physical, psychological, or socioeconomic circumstances involving that patient. For types of assessment, there's going to be everything from a comprehensive health history, a problem based or focused assessment, an episodic assessment, or a screening assessment. That comprehensive assessment is going to be completed when the patient's admitted. And it's also going to be completed should we have a new serious injury emerge. Versus a problem based or focused health assessment, this is going to be us assessing on a specific patient problem. The needs of the patient can vary wildly. The type of health assessment performed by the nurse is driven by the patient's need. The nurse has to be prepared to conduct any appropriate level of assessment. And again, that's going to depend on factors like the patient's age, their general level of health, presenting problems, the patient's knowledge level, how much do they know about their current condition, and any support systems that are among the variables that could impact these needs. The experience of the nurse. Expertise of the nurse is going to be gained with specialization within a given area. I know you all are LPNs right now. You're coming in with a good foundation, and that your growth as an RN is only going to continue to grow throughout clinicals and as you gain experience after you graduate. And each year you work, you're going to gain a little more confidence, a little more knowledge. That can also vary a bit by transferring between specialties. You may be a high expert in one area, but if you transfer to another specialty, you may drop down a little bit, not be that expert as you gain more knowledge in this new specialty area. An adult in the intensive care unit has expertise assessing a patient with hemodynamic instability, whereas a family nurse practitioner is going to be working in a women's clinic, has expertise in performing more routine pelvic examinations that an ICU nurse may have no experience with. Clinical reasoning and judgment. The nurse must analyze and interpret data before initiating a plan of care. The outcome of a health assessment is a portrait of the patient's physical status, strengths, weaknesses, abilities, their support system. What do they believe about their health? What do they believe is causing their current issues? And also their ability to maintain their current health. A healthy lifestyle, diet, and exercise. Here we just have a quick flowchart provided by our textbook on how nurses make judgment, beginning with the nurse's knowledge, experience, knowing the patient, and their expectations, everything from noticing any variations, interpreting this new data, responding, and reflecting on the data they've collected. You're going to collect a lot of data. There's going to be a lot of different information, and you've got to be able to organize that effectively. Cluster that data together, allow problems to be more clearly apparent. It could also be based on the body system format, such as cardiovascular, musculoskeletal. It could also be based on conceptual formats like oxygenation or perfusion. Data analysis, interpretation, and clinical judgment include identifying abnormal findings, correctly interpreting findings to select the appropriate plan of care, applying clinical judgment to interpret or make conclusions regarding the patient's needs, and also understanding the situation. The nurse has to respond by determining the appropriate interventions at any one moment. Health promotion and health protection. This is not only a central component of nursing, but this is also going to be a big part of NCLEX. And it begins with health assessment, identifying which data is most pertinent to the patient's health status, any risk factors, what dangers could occur, what is this patient at risk for developing down the road, and interpreting that data that allows the nurse to target those specific needs. Health promotion is that behavior motivated by a desire to increase the well being of the patient. There's also that health protection, the behavior motivated by a desire to avoid illnesses, prevent any problems from occurring down the road. Things like healthy diet, exercise. What can we do to either slow the progression of this disease or prevent it from occurring entirely? There's going to be three levels of health promotion, and this is going to be a concept you see in a lot of different areas throughout the nursing program. It's going to begin with primary prevention. This is preventing the disease. Secondary is going to be screening efforts and methods to deal with an acute issue. And finally, tertiary, which is minimizing that disability or recovering. An example I always like to use for primary, secondary, and tertiary. Primary would be you go to your primary care physician. He places the patient on metoprolol. Secondary prevention would be that patient eventually has a heart attack. That is an acute issue. Dealing with that heart attack right there is going to be a secondary intervention. And finally, cardiac rehab, recovering from that heart attack is going to be a tertiary intervention. Another framework for health promotion efforts is a government organization called Healthy People 2020. And we've provided a link there as well. It's very easy to search online if you'd like to go through it. It's managed by the U.S. Department of Health and Human Services, and these are objectives to address the most significant preventable threats to health to reduce those threats. It identifies the major areas that the American public are most at danger for. Again, Healthy People 2020 has four overarching goals. One's to attain high quality care, longer lives, free from preventable diseases such as things like diabetes, hypertension. Also, to improve health equity and healthcare access. Healthcare access is a major issue in many parts of the country. Here in Cleveland, where I'm at, they've shut down many hospitals over the last 10 to 15 years. That left major sections of a large metro area driving a significant way to see a hospital. Out in more rural areas, out in Texas or southern Ohio, there's areas where you'll drive several hours to go to a significant hospital that can provide a high level of care. And that access to healthcare has been a big thing across the country, whether it's just access to those facilities or even funding for things like health insurance. But anyway, that's all I've got for you in this chapter. I'll see you in chapter 2.